Yeah, she's grunting, so that is definitely a pain, sign of pain, spasms. And they'll go away and she'll be kind of good, and then they come back. See, she was real alert there before and eating a little bit. Now she's grunting and moving her head.
See, if she's colicky, then she needs to be up and moving, and we can't move her.
And she starts breathing hard. Her nostrils start to flare. She curls her nose. She's hurting.
You want me to give her that shot?
Okay, so Joanne here is going to try and give her a shot of Banamine, which the mare don't like, so she might get up, but...
Whoa, 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 hold still, whoa, 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 whoa.
Probably burns.
Does it burn?
Yeah, probably.
I don't know. She keeps wiggling her neck. I know it wouldn't hurt as bad if she holds still.
Yeah.
It's done.
I hate shots too.
Huh?
I hate shots too.
Yeah, me too.
Honey. Nobody likes them. But sometimes I cannot get her to eat things. They do make a Banamine paste.
Uh-huh.
But Doc says he don't keep it because there's not enough people want it and it's real expensive. And if Butte's as expensive it is, I can't imagine what Banamine must cost.
Poor girl.
Get that eye down there a while ago.
Yep. See now, I don't care what the vet says. I think this horse has Cushing's, regardless of what she has. Of course, I can be wrong. That's for darn sure. But it's just got so many signs of it. Yeah. Yeah. Yeah, she's hurting somewhere, and I think it's more than just her feet. You know? With the way that urine is, the color of that urine, she could have a urinary tract infection, or, you know, because you're giving her a lot of water. Her body, see, that's the thing. With Cushing's, they get diabetes insipidus, which is not sugar diabetes. Doesn't even mean not closely.
Yeah.
It has to do with regulating the fluids in their system, because I work with a little boy at the school that has diabetes insipidus.
What do you do?
I'm a para-educator, and I work with special ed kids. But I worked with a little boy for 2 years that had diabetes insipidus, diabetes insipidus is where the hormone that regulates the fluids in your body is affected, and your body can't control its fluid level. And so as much water as you're putting in, you're peeing out, you know.
Well, I don't know. I don't think she's peeing it.
No. But
see, like she drank that.
Yeah, but see that retained fluid, I mean, it doesn't control the fluid level.
Yeah.
You know, she's sweating it out, you know.
Oh, yeah.
See, and that's Cushing's.
Losing a lot with sweat.
That's like Cushing's too. Okay, now I'm going to look at her feet, get a good look at her feet here.
Now she's going to take a nap, please.
Get out of here, you stinking fly.
You want some eyeball in there?
No. Okay. What I'm going to try and get you a picture of here is a coffin bone. I don't know if you can see that. That bone in there.
I could get a flashlight, maybe.
Could you?
Yeah, I'll just have to go. He took my car.
Just set up on me. But you seen that flap? We're going to get a flashlight because I want you to see. Suffering. I feel terrible. Okay, I want to show you here where her abscesses have come out here, and there's some on the other side. There's a real, yeah, indentation here. I mean, this whole hoof has just basically been destroyed. And I want to show you on the back of this foot here. See, the whole hoof is just separated, and you know, draining everywhere from the bottom here. And you see, these are all pressure sores from her laying down. As I said, this has probably been going on 2 months, because you said it was June 9th when you...
But she did lay in the pasture quite a bit, but she
Yeah.
also stood out there still quite a bit.
Yeah.
Because the ground was soft then.
Well, yeah.
Because she had all that water. And her feet were soft.
This mare's toes were tremendously flared, at least 3 inches beyond where her normal toe would be. Her normal toe would be here. And she was out, well, you see, right there, I rasped off that much toe. Okay, this is the other foot, and as you can see, it's doing the same thing. She's sunk right here, and she's got an opening right here. And I had to rasp out the toe, of course, while she was laying down like this, and I noticed I got one kind of uneven. I had to fix that this morning, but anyway, poor thing.